Hello, this is Dr. Vincent McInerney. I'm an orthopedic surgeon and sports medicine specialist, and also a robotic total joint specialist for total hips and total knees. I'd like to talk to you today briefly about my experience with the T25 dynamic knee sleeves and ankle sleeves, as well as some of the compression devices for posture and back injuries. When I was training in my fellowship in Boston almost 40 years ago, we were looking into proprioception and ways that this would help someone avoid ACL tears, particularly the Boston Bruins hockey team and the New England Patriots football team. And working on gait analysis and the ways that the legs would move at the Massachusetts Institute of Technology, began to look at how we could have proprioception and not just mechanical bracing avoid injuries. With COVID-19 having hit this area of northern New Jersey harder than any place in the world other than Manhattan, we did not have any physical therapy for close to 8 months, or any therapy of much substance. And I put a lot of my younger patients and some of my senior patients into T25 or technology 25 millimeters topical gear devices that have been proven and shown to cut ACL tears down approximately 60% and cut fall risk down over 50% in older patients. These are incredible. And I'll just show you here on the model what we're looking at. We're looking at a leg here, this the knee in the middle, and the device is worn above the knee, several inches above the patella, and it consists of material similar to some of those that are out for soft knee braces on the market. And there are two bolsters or pads, one here on the VMO portion of the quad and the other one on the medial hamstrings in the back. And these exert approximately 25 millimeters of force on the VMO portion of the quadriceps and on the hamstrings. These have been spectacular in our practice. They have cut down ACL tears in our group over 50%, and they have led to, in rehabilitation, terrific ways to have people train just by walking with these devices on for approximately 2 hours a day. This has been a game changer in our practice and for our athletes, and also for our senior athletes who love them in some cases more than others. It helps get their reflex arc working in a way that prevents injury, and that's what we have found with the T25 knee sleeves. Also with the ankle Topical braces that have been out, it looks like a strap device that fits on this model's ankle. The same type of concept is stimulating the peroneal tendons to prevent lateral ankle sprains. These have been incredibly successful for us, and they again are using the proprioceptive device mechanism. Mike Decker's work at University of Denver has been incredible, and several awards have been won by Topical gear just for ingenuity. These cost anywhere from $45 to $50 each, so they're very inexpensive and they're very durable and washable. So we found both for the T25 knee devices, which are worn on the thigh, not on the knee necessarily, and those for the ankle, we've had incredible results, faster rehab, and in this case not having to go to a rehab facility at all, which was an open. So one last thing, I'll just tell you about the Wing Tech, WANG Tech device. Worn, you see in the model here, they have ribs on it. When you put this on, it really pulls your head and shoulders back so that you feel that you're in a much better position of balance. The head's the heaviest part of the body. If you lean forward just a few degrees, you're putting incredible forces on the cervical spine and the upper portions of the back to maintain your stability. So we found this is an excellent device to wear, very comfortable and very cost effective in having people maintain their posture and cut down on some of the back pain that they've been experiencing. So these are some of the products from Topical Gear that I've been using now for the last several years. I'm very pleased with my preoperative training of people, including for total hips and total knees, and postoperative. Cut down tremendously on the costs of long-term physical therapy. Patients have been able to have their physical therapy and then end it sooner and wear these devices thereafter. So very pleased, very forward-thinking for our practice. We're very happy to have engaged in this some of these research projects.